Turning now to the COVID-19 situation in South Korea, the government says it's keeping the 7-day mandatory quarantine period for those infected with the virus. This will remain in place for at least the next 4 weeks. However, some virus prevention measures have been loosened, as our Song Yoo-jin explains.
Mandatory quarantine for those who test positive for COVID will stay in place for 4 more weeks. This means those who catch COVID will still have to self-isolate for 7 days. The decision was made at a Central Disaster and Safety Countermeasures headquarters meeting on Friday. Health authorities decided to keep the quarantine rules in place over fears of a possible virus resurgence.
Although South Korea has the medical capacity to contain the virus, the number of COVID-19 related deaths is still relatively high. So, we evaluated that relieving quarantine measures could trigger an early virus resurgence and cause more damage.
However, the government could lift or shorten the quarantine if they deem the country's virus situation as stable, with the situation to be reassessed every 4 weeks. However, there is some good news for those who have loved ones at care facilities and nursing homes.
Before, only those who have been fully vaccinated were allowed to make in-person visits, but now their visitors can come regardless of vaccination status. Also, care facility residents who have gotten their 4th shots will be able to leave their residence.
With the safety of residents in mind, reservations for visits should still be made beforehand, and visitors will have to get a PCR or rapid antigen test. Meanwhile, South Korea saw 7,198 new COVID-19 infections on Thursday. That's down almost 800 from the day before and is the 8th straight day for the figure to stay below 10,000. There were 9 related deaths and there are 82 critically ill patients. Song Yoo-jin, Arirang News.